The Commonwealth of Virginia Health Benefits Program. What's happening for July 1st, 2012? We'll take a look at the open enrollment period of May 1st through 25th and let you know what will happen for the plan year beginning on July 1st. There's news you can use, plus information on premium changes, plan changes, and flexible reimbursement accounts. Mainly, you will want to know what this means for you. What you decide to do during open enrollment is up to you, but when making your decision, you will want to consider the best options for you and your family. Review the open enrollment material sent to you. If you are an employee, the material will be the Spotlight newsletter. If you are retired, it will be your rate notification package. Be sure to visit the open enrollment link on the DHRM homepage and enroll or request changes by the deadline of May 25th. Use Employee Direct online to enroll or make changes, or you may request an enrollment form from your benefits administrator. You may also download a form from the web. Just be sure to submit the form to your benefits administrator by the deadline. You must take action by May 25th. You can enroll in or change your health plan, add or remove eligible family members. It's important to remember to document eligibility when adding dependents. You can also waive your health insurance coverage. During open enrollment, active employees may also enroll in a medical or dependent care flexible reimbursement account, or FRA. Remember that if you take no action, you remain in the same health plan you have now, and you will have no FRA because current FRAs end on June 30th. Here's the news you can use. Choice. You may enroll in either COVID Care or COVID Connect, regardless of where you live. If you want a different plan, be sure to submit your change during the open enrollment period. Remember, if you take no action, your current health plan election remains in effect for the next plan year. You may elect these statewide plans at open enrollment. COVID Care. Anthem administers medical benefits, Medco, prescription drugs, Delta Dental, dental benefits, and Value Options, behavioral health, and the Employee Assistance Program, or EAP. COVID Connect. Optima Health administers all benefits except for dental, which is administered by Delta Dental. Both COVID Care and COVID Connect are available with or without optional benefits. Expanded dental, out-of-network, and vision and hearing are available for an additional cost. COVID HDHP is the high-deductible health plan administered by Anthem. Optional benefits are not available under this plan. The Health Benefits Program also offers a TRICARE voluntary supplement that coordinates with federal TRICARE benefits. Only military retirees and family members are eligible for this plan, and there is no employer contribution. The state has one regional health plan, the Kaiser Permanente HMO. It is available only for participants who live or work in Northern Virginia, Fredericksburg, and some Central Virginia zip codes. For more information, see the Kaiser website. If you are thinking about enrolling in a new plan, there are some things to consider. First, do your research. Go online to the new plan administrators' websites and find out more information about what the new plan offers. Call the plan's customer service number and ask questions, or contact your agency's benefits administrator. Also, be sure to check that your health care providers are in the new plan's network. Some plans will not cover services if your provider is out of the network, except in an emergency. If a plan does cover a service out of network, you may have to pay more. Each health plan has a different prescription drug formulary. It's important that you check to see what tier your medication is on. One of your drugs could be on a higher tier in one plan and a lower tier in another plan. Your premiums this year may change pending final approval of the state budget. Be sure to look at the premium that applies to you. Premiums are found in your open enrollment materials. Remember that you pay for any optional benefits that you select. Beginning July 1st, federal health reform funds are being used to subsidize premiums. These dollars are from the Early Retiree Reinsurance Program, or ERP. The state is using this money to reduce the premium contributions that employees and non-Medicare eligible retirees will pay in the coming plan year. Your health plans will have several changes for July 1st. Let's look first at CovaCare and CovaConnect. Many employees have asked for an annual vision benefit, so we've implemented that in the coming plan year. The optional vision benefit will be once every 12 months rather than once every 24 months. We're also featuring a new program to help members with diabetes take better care of themselves. The Diabetes Management Pilot Program will apply to you if you have diabetes and you are in a disease management program. If you meet certain requirements, you will get Tier 1 and Tier 2 drugs and supplies at no cost to you. Details on this program will be coming soon. If you are interested in this pilot, be sure to check the tiers for your current diabetes drugs before you decide which plan to choose. There are also some plan changes that come from General Assembly legislation. IV and injected cancer drugs will be covered like infusion services. For statewide plans, CovaCare, CovaConnect, and CovaHDHP, you will pay a deductible and then 20% coinsurance. The plan will pay 80%. The Kaiser Permanente HMO has a copayment for these services. All plans are adding coverage for Applied Behavior Analysis, or ABA, for children ages 2 through 6 with autism spectrum disorder. There is a $35,000 annual limit on what the plan will pay for ABA services. The regional Kaiser Permanente HMO plan also has changes this year. There will be a $50 copayment for ambulance travel, and prescription drug copayments will increase at Kaiser Medical Center and community pharmacies. In addition, at medical center and community pharmacies, you'll pay 3 times the 30-day copayment for a drug supply of up to 90 days. If you use the Kaiser Home Delivery Pharmacy, you'll pay 2 times the 30-day copayment for a supply of up to 90 days. So what's coming for flexible reimbursement accounts, or FRAs? Active employees can set aside pre-tax dollars each plan year to pay for eligible medical or dependent care expenses. Beginning July 1st, there is a new FRA service platform. You can register on the website after you receive your open enrollment confirmation. You'll be able to track your account online, get email confirmations, use the Pay Me Back claims form to file online, and validate claims for medical FRA card transactions. You can even pay your health care or dependent care providers online. Speaking of the payment card, FRA participants will receive a new medical FRA Visa payment card in the mail at their home addresses before July 1st. And something for tech-savvy employees, a smartphone app to manage claims and use of your payment card. The maximum contribution to a medical FRA is changing to $2,500 in the new plan year due to the Affordable Care Act. There has been no federal limit before on medical FRAs, only an employer limit. The Commonwealth's limit has been $5,000. The dependent care FRA's maximum contribution will remain at $5,000. And remember, it is limited by your tax filing status. One more important point. Use the money in your current account by June 30th and request reimbursement by September 30th. The IRS does not allow funds to be carried over to another plan year. We've talked about your premiums, plan changes, and FRAs. You may be asking, so what do I need to do? The answer is online. Visit Employee Direct at edirect.virginia.gov. Log in and select Health Benefits Enrollment and Information. You can check your health benefits profile to see your current election. You can update your personal information, such as your home address and email. And you can request changes during open enrollment. You can request changes beginning May 1st. Be sure to take any action by the deadline of May 25th. After you make an election, you can change it as long as you do so by the deadline. If you are turning in an enrollment form, submit it by the close of business on the 25th. You can use Employee Direct until 11:59 p.m., but be careful. It's best not to wait until the last minute. Remember, You can't make any changes after open enrollment ends. There are multiple resources you can use for additional information. Employees should carefully review the Spotlight newsletter sent to your email and home address. Retirees not eligible for Medicare should pay careful attention to the rate notification mailed to your home address. You can also visit the Open Enrollment link on the DHRM website at the web address shown. If you have questions, contact your agency benefits administrator or call the plans. Plan contact information is included in your open enrollment materials. Finally, be sure during open enrollment to plan carefully. Think about what's best for you and your family, and take any action before May 25th. Thank you.